Request Dr. S. Sachitanand, a former Vice Chancellor, RGUHS Karnataka, kindly take over the podium and introduce the guest. Thank you so much, sir. I request Professor Sachitanand sir to kindly invite the Professor Michael Kurtz to continue the session.
I request Dr. Kurtz to come out to the podium, please. Good afternoon. The first session after lunch, Dr. Michael D. Kurtz is selected in 2001 by Arizona Health Sciences Center as a Dean Teaching Scholar and has received numerous teaching awards. He is a past chair of the American Society of Health System Pharmacists Commission on Therapeutics, has numerous publications and including pharmacotherapy principles and practice study guide. The case-based care plan approach, now in its 6th edition. He has been involved in Intercollege of Pharmacy Directors, Director of International Programs, National Education and Practice over 20 years. And he serves as he also received in 2010 University of Arizona's prestigious Excellence in International Education Award. He serves as the co-chair of the Board of Directors of the US Thai Pharmacy Consortium. He has received Paul E. Parker Lifetime Achievement Award from the University of Kentucky, College of Pharmacy and UK Healthcare. He will be talking to us on a very interesting topic, vaccinations. As you all know, vaccination is a boon to humanity. Without vaccination, we would have lost so many lives every year. It is estimated that more than 3.5 to 5 million lives are saved every year with vaccinations. And this vaccination schedule keeps changing every year. We keep adding more and more diseases. And it's been wonderful that we have been able to conquer a lot of infectious diseases, both viral and bacterial, with vaccination. Thanks to Edward Jenner, who was the first one to vaccinate himself with chickenpox. And then he was the father of vaccination. And as you all know, recently India played a big, major role in supplying vaccines, COVID vaccines to the entire world. And that saved a lot of lives during COVID as well. With all this background, I would request Dr. Michael Kurtz to go ahead and give his lecture on vaccinations. Over to you, sir.
Thank you. Thank you for that very kind introduction. It's truly an honor and a pleasure for me to be here today. So greetings to all of you from the United States, and hopefully this session will be interesting for all of you. So as you heard, I'm a pharmacist. I work with the College of Pharmacy, and I know that we have a variety of different health professionals here today. We have physicians, we have nurses, physical therapists, pharmacists, and many students. So while I usually will present this topic from the point of view of pharmacy, I'll try to make this as broadly and interesting and useful as possible. Vaccination is not a new topic. However, I think all of you would agree that the COVID-19 pandemic really put vaccination and its importance in the forefront. And every country, certainly India, certainly my country, the United States, was very active in trying to deal with the COVID pandemic. And you can see the results of the pandemic. This is as of January of 2023. how many cases of COVID-19 there were. As you can see, 668 million. About 6.7 million people died as a result of this. And hopefully all of you would agree that the morbidity and mortality from COVID-19 was certainly reduced by our efforts for vaccination. So first I'm going to talk a little bit about probably something all of you know about, and that is what are the benefits of vaccination. And I think it's always helpful in this day and age especially to remind ourselves and also remind our patients and the public why vaccination is so important. And if you really look at all of the public health efforts that have occurred over centuries, things like clean water, of course, are very, very important public health advances. But I think most of us as health professionals would agree that vaccination has really been one of the most successful and certainly cost-effective public health interventions. And there's plenty of research data showing that vaccination saves millions of lives every year and has tremendous benefits to individual people as well as to communities, whether it's villages, towns, cities, states, and whole countries. And of course, the idea that, again, all of you health professionals know about is if we can vaccinate a large enough number or a large enough percentage of our population, that provides the herd immunity so that it becomes very difficult for a pathogen to really become widespread and cause large numbers of infection. So the public health effort over many decades now has been to vaccinate as many of our population as possible, and with a particular emphasis on trying to protect more vulnerable people in our population, such as newborn babies or young infants, people who are immunosuppressed, whether it's from underlying disease or from their therapy, and of course, people who can't get vaccinated because perhaps they have a severe allergic reaction to some component of the vaccine. So really what we're trying to do with vaccination, of course, is control disease if we're having an outbreak, which was the strategy for COVID-19, eliminate disease, which has happened with smallpox, and hopefully eradicate disease as much as we can. So we've been very fortunate, as I just mentioned. Smallpox has been completely eradicated from the world. Polio has not been totally eradicated, it's still present, but certainly has been under better control. And measles, mumps, and rubella, until recently, had also been under great control. And of course, remember that vaccines don't only prevent infection, we also have vaccines that can prevent cancer. So the human papillomavirus vaccine, or HPV, hepatitis B vaccines have that added benefit of being cancer preventative. As healthcare workers, I think all of you know our healthcare system, no matter what country we're in, is overburdened. And if we can reduce the number of people with infections, of course, that's going to reduce the burden on our healthcare system. And then that will certainly have economic benefit if people are not sick and hospitalized. That saves money. And from an overall societal standpoint, certainly there are benefits. Now, everything I just said sounded really positive, and vaccination's been great, but thinking, not thinking about COVID for a moment, at least in the United States, we're seeing now outbreaks of diseases that we thought were under good control. And what you see on the slide is information about our recent and ongoing measles outbreak in the United States. It started in Texas, and as you can see, has spread to many parts of the US. This is still an ongoing problem. And then we've seen small outbreaks of polio and detection of polio virus, particularly in the New York area. Now, there's a lot of discussion about why we're seeing these outbreaks, but I think most people in public health agree that these outbreaks are related to inadequate levels of vaccination. And we're seeing fewer people being vaccinated for things like measles and polio, and now we're starting to see outbreaks of these diseases. So again, it's the end result of fewer people being vaccinated. So the question is, well, why aren't more people getting vaccinated, or why are fewer people being vaccinated? And again, we could spend hours talking about that as well. And I'm sure it differs from country to country, but something we've seen in the United States, even before the COVID pandemic, but certainly during and since the COVID pandemic, is what we call vaccine hesitancy. People are hesitant to be vaccinated, or parents are hesitant to have their children vaccinated. Now, there's lots of reasons for this, and there's been lots of publications about it. One important factor certainly is misinformation and disinformation. We've seen a tremendous amount of that in the United States with the so-called anti-vax movement, and particularly using social media to spread misinformation and disinformation. And the end result of that is that people start losing trust in the healthcare system and in health professionals. And unfortunately, many of our patients will see something on social media, believe it, but then when we as health professionals give them accurate information, they seem more apt to believe what they see in social media. So lack of trust has been a problem. There certainly are valid concerns that we all have about safety and adverse effects related to vaccines, and no vaccine is 100% safe. There's always going to be adverse effects, but when you balance the adverse effect profile of vaccines versus their benefit, you know, certainly the benefits greatly outweigh the risks. Complacency. When I was a child, measles was very prevalent. I was a child before we had the MMR vaccine, so everybody got measles, but with the MMR vaccine, measles pretty much went away, and I think most people felt that measles was ancient history and we don't need to worry about it, so why get vaccinated? And certainly in some countries there may be, or certain populations, there may be cultural or religious beliefs that may get in the way of vaccination as well. We don't have time to talk about all the details as far as vaccine hesitancy, but here's some more details from one publication that came out last year, looking at, again, some of the more specific reasons as far as why people become hesitant to become vaccinated. And certainly communication and the media environment is certainly one, and that certainly includes social media, politics, and political beliefs, beliefs and attitudes about health and health prevention. So point being is that this vaccine hesitancy that we're seeing, it's pretty complicated. And of course, as you work with individual patients, you have to try to explore what the root causes are of their vaccine hesitancy, and then again, try your best to give them accurate information. Now, of course, our strategies to reduce vaccine hesitancy and improve the rate of vaccination is going to differ depending on whether you're talking to an individual patient or parent versus more of a large population strategy. I think really the key is going to be providing clear, understandable communication to patients in a way that the patient can understand. And of course, the health literacy of our patients varies tremendously. So we have to make sure that the messages we're delivering and the information we're providing is appropriate for that patient's health literacy. I mentioned before that loss of trust or lack of trust is a factor. So building trust with your patients and having that clinician-patient relationship really goes a long way towards improving the acceptance of vaccines. I think we have to address mis and disinformation just head on and tell patients that what they're seeing on Facebook or Instagram is not accurate. It's not good science, and here's the real science. So vaccine hesitancy and misinformation is not a new thing. So this cartoon from 1802 is showing misinformation about cowpox vaccine, which was used to prevent smallpox. And it may be difficult for you to see if you're in the back, but you can see the woman in the middle being vaccinated, but then people in the background, they're turning into monsters or turning into cows. So again, this was misinformation published in a newspaper in the 1800s. And I think also making sure people understand what the benefits of vaccination really are, but thinking about from a healthcare system standpoint, what some of the barriers are. And I think factors such as access to vaccine, affordability of vaccines is really important. And particularly for patients who may live in rural areas where there may not be a lot of healthcare workers, that can be a particular challenge. Depending on your healthcare system and insurance schemes, financial cost may be a barrier. If it's inconvenient for patients to get a vaccine, if they have to take off time from work, if it's just very inconvenient for them, that they're less likely to do it as well. So one of the ways we can help improve vaccination rates is by improving access and improving affordability. Certainly, no matter what country we're in, we have health system issues and problems. We have supply chain issues, and with vaccines, since most vaccines have to be kept or stored at a certain temperature, the cold chain logistics, making sure that vaccines are stored properly, is going to be very, very important. And of course, that's especially challenging in a more rural environment. There may be occasional supply shortages, which makes things difficult. Healthcare workforce and capacity. In most countries, our healthcare system and our healthcare workers are overwhelmed. There's too many patients and not enough of us. So anything we can do to improve capacity, increase the number of healthcare workers who can provide vaccines, that's going to increase vaccination rates. And then, of course, in countries that are politically unstable or during wartime, we know that health systems in general don't function very well during political conflict and war, and we see outbreaks of disease, certainly during political conflict. So, talking a little bit more about accessibility and workforce capacity, the bottom line is that common vaccines should be as easily accessible as possible. Should be convenient for the patient, and it should be inexpensive. Now, just speaking for my country, the US, for us to go see our physician, it's really inconvenient. Often we can't get an appointment for months. It may not be convenient from our work standpoint. Parking can be a problem. It may cost money, so that's a real barrier. So certainly in the United States, and I think in most countries, anything we can do to increase the number of healthcare workers who are able to provide vaccines, that's going to increase vaccination rates. One of the benefits of, if there were any real benefits of the COVID-19 pandemic, was the opportunity to look at how healthcare workers are actually functioning and actually expanding the scope of practice of healthcare workers and allowing more professionals to prescribe and administer vaccines. And that certainly is true for my profession in pharmacy. We saw many countries expanding the scope of practice for pharmacists, allowing them to provide vaccines during the COVID pandemic. And if you want to talk about convenience, in most countries, pharmacists are truly the most accessible health professionals. In most countries, there's pharmacies everywhere, and pharmacists, we certainly see in the United States, can easily be trained to administer vaccines in a safe and effective manner. Now, from a global standpoint, my profession has really taken ownership of trying to expand our role for vaccination, and this has been through a global organization called FIP. And the point of expanding the pharmacist's role in vaccination is not to say that other professionals, nurses, physicians, others, can't or shouldn't do it. The idea is to expand the workforce capacity so that more people are able to give vaccines and then hopefully increase vaccination rates. So this gives you a snapshot of some countries that now allow pharmacists to give vaccines, the blue-colored countries. Unfortunately, India is not there yet, but I know there's a lot of work being done here, working with the Ministry of Health to try to expand the scope of practice for pharmacists here in India. So that's a little bit of background in general about vaccination, vaccine hesitancy, some thoughts perhaps on how we can increase vaccination rates. And again, one way is to take advantage of pharmacists in your country and allow them to administer vaccines. So next I'm going to focus a little bit more on mass vaccination and use the COVID pandemic as the starting point for that discussion. Well, of course, every country dealt with the COVID-19 pandemic. Here in India, you can see from the slide there are about 44 million confirmed cases of COVID-19, resulting in about 500,000 deaths. Given the population of India, that's actually not as bad as it may seem. My country, the United States, our population is about 1/4 or 1/5 the population of India. We had twice as many people die in the United States, and lots of reasons for that that we don't have time to talk about. Looking at the number of COVID vaccines administered in India, you can see over 2 billion doses were administered and about 1 billion received at least one dose of vaccine. And that's, given your population is about 1.4 billion, that's really pretty good. So about 75% of the population received at least one dose of COVID vaccine. Of course, we would want it to be 100%, but 75% is still pretty good. Well, we've known for decades and even centuries that the only realistic way out of a pandemic is vaccination, no matter what the cause is. And what we have to do is prepare ourselves as best we can. And given that we just went through a major global pandemic, to learn from that experience, so when the next pandemic occurs, we're going to do even a better job. So the challenge for India, as you were challenged with COVID-19, is how will your country vaccinate 1.45 billion people quickly so as to minimize morbidity and mortality and prevent development of vaccine-resistant strains. We did okay with the COVID pandemic, but we can certainly do better. I did mention a moment ago about vaccination by pharmacists, and just so you know a little bit more about that, to promote my profession a little bit. In all 50 states in the U.S., pharmacists are empowered to give vaccines. They're trained to give vaccines. And while every state in the U.S. has slightly different rules, again, in every state, pharmacists can give vaccines. And in fact, now the majority of adults in the United States receive their vaccines in pharmacies, not from their doctor, not from nurses. And again, that's simply because of the convenience factor. And all states require that pharmacists be trained to give vaccines, and this would include pharmacy students. And in fact, in our school, and I think most pharmacy schools in the US, we actually train our new students within the first month after they join our program, train them to administer vaccines and actually certify them to administer vaccines. So this is actually one of my now former students. She graduated a couple of years ago. She was, I think, a first-year pharmacy student at that point, and she's actually administering influenza vaccine to another university student. You can tell this was during the COVID pandemic because she's wearing the face shield. And certainly the countries that allow pharmacists to administer vaccines are doing some training. But as you can see, some countries, including India, are actually now providing training for pharmacists to give vaccines in the expectation that the Ministry of Health or the government will open that door and allow pharmacists to provide more vaccines. So focusing a little bit more on mass vaccination in the COVID pandemic, this quote that you see was actually from when President Obama was president of the US, and his chief of staff used this quote very widely: to never let a crisis go to waste. Meaning that when we're facing adversity, let's learn from it so that the next time we can do an even better job. And we know that whether it's influenza pandemic, whether it's COVID pandemic, whatever the pandemic is, we know that mass vaccination is going to be the most efficient method to quickly vaccinate large numbers of people. There's a really nice review article published in the New England Journal of Medicine in 2021 if you want to learn more about sort of the public health aspects of mass vaccination. Mass vaccination is great, but in reality, any vaccination effort during a pandemic has to utilize a multiple strategy approach. People who live in rural areas, there's not masses of people to come together to be vaccinated. What about people who are in nursing homes or long-term care facilities, people who can't leave their home because of physical disability or don't have transportation, people who are suspicious and untrusting. So even though mass vaccination can be efficient and we can target a large number of people, we can't forget about those other populations to make sure that we're providing service and providing vaccination to as many people as we possibly can. And basically the idea is for every country, every state, every city, every village to develop general guidelines and approaches, but then when a pandemic actually happens, you adapt your policies, you adapt your procedures to fit whatever is happening. So some of the elements of a mass vaccination program, certainly one is leadership. What you don't want in any public health effort is chaos and disorganization, so you need some central leadership. In the United States, we use the incident command system, which is a somewhat militaristic system, but it works really, really well. And the idea is you want standardized approaches to managing an incident. That incident could be an earthquake, could be a fire, could be a terrorist attack, or it could be a pandemic. And one of the ideas is coordination. Many people, many agencies are going to be involved in emergency response. We want to make sure that there's good communication and good coordination among all those different people and different agencies. Again, if you look at the website linked on the bottom, you can get a lot more information about the incident command structure. One thing we learned actually in the early 2000s when we had outbreaks of anthrax as terrorism in the United States is that when vaccines or medications are involved, pharmacists have to be at the table in the incident command team. We learned in 2001 when we were dealing with anthrax that our public health departments actually didn't know what pharmacists could do. So we had to do some education of our public health structure, and now literally we are at the table in the United States, and that has to occur in every country. So anytime there's medications or vaccines or other pharmaceuticals involved, when you're dealing with emergency planning or emergency response, pharmacists have to be part of that. And of course, we want to prepare for bad things to happen. We don't want to wait for bad things to happen before we do something. So plans should be developed, practiced, and in place before something happens. And the idea is we plan for any hazard, because we don't know what's going to happen. Will it be a pandemic? Will it be a terrorist attack? Will it be a nuclear accident? Will it be a natural disaster? We don't know. So we have to prepare for everything. Now, I started being involved with my university with this actually in 2001 and started working with our county health department in 2003, developing plans both at the county or state level as well as at the university level. About now 12, maybe 13 or 14 years ago now, we actually developed a pandemic influenza plan for the university and practiced it many times, and then we had that on the shelf. And fortunately, when COVID-19 happened, we were able to use that influenza plan, adapt it a little bit, and it worked very, very well. So, point about practicing, this is a mass medication dispensing exercise. This was in the face of the anthrax outbreak we had in the United States, where we actually practiced or mocked an anthrax outbreak, mobilized our national medication system, and had the public serve as actors as patients, and then we evaluated them and managed them. And we were able to manage about 3,000 people in about a 4-hour period during this exercise. Now, this was not an exercise, this was real. Some of you may have heard of Hurricane Katrina, which hit the New Orleans, Louisiana area in 2005. Because Louisiana was completely inundated with flooding, they were taking people and bringing them to other cities in the U.S. as refugees, and my city, Tucson, served as one of those refugee sites. So we had about 48 hours to develop a plan to accept potentially thousands of refugees, and we actually opened a pharmacy. This was in our local convention center, and we took over a snack bar, a food area, turned it into a pharmacy. Again, we had about 48 hours to do that. So this was real, but it was also great practice for us to learn how we could get people together, quickly develop a plan, and then implement that plan. So I mentioned our influenza plan that we had. It was mostly a drive-through vaccination plan. People would stay in their cars and be vaccinated in their cars. I know this is hard to see, and that's okay, but this is the plan we developed about 15 years ago for influenza that we then adapted for our university for the COVID pandemic. So again, most of the patients stayed in their cars, were evaluated in their cars, vaccinated in their cars, and observed in their cars. And this is the information that was given to the public as far as where they should drive, where they would stay, and again, just mentioning that point again, that communication, and particularly communication with the public, is really, really important, and making sure that communication is accurate and consistent so that there's not mixtures of messages being delivered to the public. So these are actual photographs of our mass COVID vaccination operation at our university. It was in the center of the university in front of our basketball stadium. Again, so people were screened in their cars initially to make sure they were eligible to receive the vaccine, and then they drove under these tents to the vaccination area where we had individual vaccination stations. So at the peak, we were vaccinating about 5,000 people per day, and at times we were very understaffed, so it was very, very busy. We worked in teams of 2. We had a vaccinator, and yes, that's me there, and the woman next to me, she was a nursing student at the time. She's now a practicing nurse. So we worked together basically with each car to screen the patient, record their information, and actually give their vaccine. I have to say, giving vaccines to people in a car was somewhat challenging, but you have to learn how to make it work. Now, of course, India had its own mass vaccination programs. This article that was published a couple of years ago, labeled India's effort as the world's largest COVID-19 vaccination campaign. And again, with a population of 1.45 billion people, you have a lot of people to vaccinate. And in India, you did a really great job vaccinating large numbers of people. Now, COVID was not the only thing we were dealing with. I'm not sure if this happened in India or not, but in the United States, in European countries, other parts of the world, we had what was called monkeypox, now it's called mpox outbreak. So some of us were also involved with vaccinating high-risk individuals against mpox. And the smallpox vaccine, which is still available, is actually very effective in preventing mpox as well. So I've already mentioned communication, collaboration, and coordination. I can't emphasize how important this is in a mass vaccination effort. There's a lot of people working, there's a lot of patients. It can be confusing, it can be chaotic. People can be scared if there's an outbreak of some potentially fatal disease. So it's very, very important, again, that you have good communication internally within the vaccination effort, but also to the public. Frequent meetings with your staff to make sure everybody's on the same page. And you want to make sure that however the vaccine is being produced, whether it's being drawn up in syringes or thawed out if it's frozen, ideally that should be very close to where the vaccine is being administered, so there's not going to be transportation issues to get vaccine from production to administration. Regulatory and reporting compliance, of course, that's going to differ from country to country and state to state, but someone needs to make sure they're keeping track and control of inventory, make sure that there's reporting, whether it's on paper, whether it's online, of vaccine administration. And of course, to have a mass vaccination effort, you need lots of volunteers. And you need to make sure, someone needs to make sure that those volunteers are actually qualified to do what they're being asked to do, that they have some sort of professional license, that there's at least legal opportunities to allow people perhaps to do things out of their usual scope of practice. And we also feel that using students is a great way to improve our workforce capacity, whether it's health professional students to actually administer vaccine or produce vaccine, but also other students to help with traffic control and screening and registration. Now, another shout out for my profession, pharmacy, and we're probably the best health professionals dealing with supply chain management, because that's what we do, whether it's in a hospital setting or in a community pharmacy setting. So, supply chain, especially when there's shortages of supplies, and all of you remember when COVID vaccine first became available, it was in very short supply. So we needed to make sure we kept track of every single vial and that we didn't waste any doses. Certainly someone needs to be aware of the unique storage and preparation requirements of each product, whether it has to be frozen, at what temperature, what happens if the electricity goes out, what happens if there's no electricity. So again, that's really, really important. And of course, training and supervision of all personnel. You may be having people doing things that are not in their usual scope of practice. You want to make sure that people are trained to be able to do what they're being asked to do. So at our university mass vaccination operation, we actually had a trailer that was physically next to our vaccination operation. So we had pharmacists, nurses, pharmacy technicians, students drawing up the vaccine from us, thawing the vaccine from the freezer, drawing up the vaccine, and then providing it to the vaccinators. The person on the bottom right with the black mask on, he was actually the governor of the state of Arizona at the time. He came and toured our operation. So we had at least the political support to doing what we were doing. Now again, I'm focusing on my experience in the United States. Of course, the experience in India is different. I think certainly the good news is there's lots of information from your Ministry of Health and other agencies here in India to provide you as health professionals, but also the public with information about COVID vaccination. So, if you haven't seen this website, it may be worth taking a look at. As I mentioned earlier, everybody's concerned about vaccine safety. Of course, we're worried about effectiveness as well, but patients certainly are worried about safety. Parents of kids are worried about safety, and those concerns are completely valid. But we also want to make sure it's safe for the people who are working. You need to have adequate space for people to work. If you're doing a drive-through operation like we were, you need to make sure that there's traffic control. We don't want people being hit by cars. Temperature control, things like refrigeration. With the COVID vaccine, of course, the rule was we wanted to observe people after they received the dose of vaccine for 15 to 30 minutes to make sure they weren't going to have any severe reaction. And of course, we needed to have medications available to treat allergic reactions. So we had epinephrine, we had diphenhydramine, we had corticosteroids available. And with our mass vaccination operation, we had a physician who was always on site in case someone was having a problem. And of course, dealing with children, has its own challenges. Whether you can or should vaccinate women who are pregnant or women who are breastfeeding. Of course, that's going to be very dependent on what the vaccine is, but you have to consider those special populations who may not be treated as a, quote, typical patient. I've already mentioned staff resources. Again, we want to make sure that we have enough people.
So could you
to
please
staff.
conclude, sir? Time is up. Please conclude as early as possible. Time is up, sir.
Okay, let me go to the last slide then. Thanks. This will be the last one. So just to let you know, as far as our mass vaccination operation, it lasted for 143 days. We administered 243,000 doses of COVID vaccine over those 6 months. So we felt it was very successful. So thank you for your attention. And if you have any questions, I'd be happy to answer them. I would be happy to answer them. So thank you again.
Thank you, sir. Thank you so much. You very clearly outlined the various problems and hurdles that we have in mass vaccination. India has a great experience as far as COVID vaccination is concerned. We had our vaccination policies. Both Covishield and Covin vaccinations were given to 200 crore or 200 billion Indian population. We also supplied vaccines to more than 150 countries. So that was our achievement during COVID, and we learnt a lot during COVID period. COVID pandemic taught us a lot. Thank you so much, sir. Are there any questions from the audience? Thank you, sir. There are no questions. Thank you.
Thank you. Thank you, Dr. Michael, for the nice informative thought. Now, I kindly request Dr. Puspa Sarkar, Madam, Dean, School of Health Sciences, to facilitate, present the memento and certificate of appreciation to Dr. Michael Kurtz. Thank you, Madam. I also request to hand over my mentor to Dr. Sachitanand, sir, former Vice Chancellor, RGUHS. Thank you so much, Madam.